Good evening. My name is Javaris D. Polk. I will be serving as the moderator of the National Black Nurses Association webinar entitled African American Men and COVID-19. I would like to first thank the National Black Nurses Association for hosting this event, and we are incredibly grateful to Mr. Ellis Dean with blackdoctor.org, as well as Johnson & Johnson for sponsoring this webinar. A few housekeeping rules. We'd like for you to please mute your microphones so that we can ensure that everyone hears the dialogue we have today. If you have questions throughout the event, please place them in the chat box, and if time permits, we will address them accordingly. Just to give a little background on me, I worked as a firefighter paramedic while pursuing my BSN degree in Birmingham, Alabama. For the past 2 years, I've been working as a traveling nurse, and I have firsthand knowledge of taking care of COVID-19 patients. I have seen death and the disheartening impact that it has had on the families and my colleagues. In particular, the disproportionate effect that it has had on the African American men and women alike. Today, along with 4 other male panelists, we are going to have an engaging conversation on African American men and COVID-19. I will now introduce the panelists. Our first panelist will be Mr. Josie Perpigman. He is a critical care registered nurse at the New York Presbyterian Columbia Hospital in the intensive care unit float pool. He received his BSN degree from the University of Rochester School of Nursing in 2016 and is currently enrolled in the post-BS DNP Family Nurse Practitioner Program. Mr. Perpignan is a founding member of the Greater New York City Black Nurses Association and was honored as the 2020 Healthcare Hero on the Live with Kelly Ripa and Ryan Seacrest show, ultimately winning a $100,000 grant. Our next panelist is Mr. Carter Todd. He is an assistant nurse manager and the president of the Capital City Black Nurses Association. Is Mr. Carter Todd in Sacramento, California. He is a recent graduate of the Betty Irene Moore School of Nursing's Master of Science Nursing Leadership Program at the University of California, Davis. Mr. Todd is a recent recipient of many awards, including the 40 Under 40 Award from the Sacramento Business Journal, the Emerging Nurse Leaders Award given by the Association of California Nurse Leaders, and the 40 Under 40 Award given by the National Black Nurses Association in 2019 at the national conference held in New Orleans, Louisiana. Our next panelist will be Dr. Eric Walsh, who is a graduate of the University of Miami School of Medicine and the Loma Linda University School of Public Health. Mr. Perpignan is a founding member, master's and doctorate in public health. University School. He has served as advisor on HIV/AIDS to Presidents George W. Bush and Barack Obama. Dr. Walsh partners with Dr. Batiste in the Slave Food Project. This project links stress, discrimination, and nutrition to health disparities, but seeks to empower communities of color to live in wellness. Our last panelist, last but not least, will be Dr. Columbus Batiste. Dr. Batiste is a board-certified interventional cardiologist and assistant clinical professor at the University of California, Riverside School of Medicine. Dr. Batiste is a member of the Association of Black Cardiologists with a mission to share information so that each one can teach one about the benefits of plant-based nutrition, daily exercise, and stress reduction. If you remember, Dr. Batiste was a guest speaker for the ABC session at the NBNA 2021 annual conference. Please give a warm welcome to all of our panelists. All right. Can everybody hear? Guys, everybody? Okay. All right, let's talk about the data. From Johns Hopkins COVID dashboard as of November 15, there have been just over 47 million total COVID cases. There have been a total of 763,000 deaths, and almost currently 11,300 people in ICUs. My first question will go to Dr. Walsh. Dr. Walsh, it feels like people are starting to exhale, yet based on the increases in these current 22 states, mainly the West, Midwest, and Northeast, does it make sense to exhale? What are your thoughts?
Well, thanks for having me on. Good to be with the brethren tonight. This is a tough time. The clinics that I run, we do a lot of work around COVID testing, and follow up, putting people into COVID treatment protocols and so forth. And we are seeing an uptick right now here in New England. I'm in Connecticut, and we are seeing an uptick. It is a little bit scary as we're seeing this uptick. Again, we're worried as disproportionately African Americans, Latinos have been affected. But I think we have to continue to be careful. There's still a lot we don't know. I think it's important to remember that this virus and this outbreak, this pandemic, is still less than 2 years old. So there's a lot of science, a lot we still don't know. And I think part of the problem is, people are pretending to act as if we do know, and we really don't know. There's a lot we don't know. So I would continue to be careful. So I think, of course, hand washing and all of the hygienic things we can do are important. Masking is important. I still think that works, even though there are a lot of people who don't. But the biggest thing I think is these vaccines. And, a lot of people make the argument that the vaccines are going to stop the spread of the virus. I think for African-American men, especially those with comorbidities, hypertension, diabetes, etc., or even a stressful life, the vaccine is a way to protect yourself. And I don't think we're portraying that well. If you get this, the coronavirus, it's not just death and hospitalization we're worried about, but it's also, we're very worried about long haul and long-term symptoms of the virus. So, I think we do need to continue to encourage people to get the vaccine, because we don't know where we're going next with this.
Thank you so much, Dr. Walsh. That was very well said. This next question will go to Mr. Josie Perpigman. So I mentioned that I worked in the ICU, and it's been pretty rough over the last 2 years, especially as a traveling nurse, even with staff as well. So, Mr. Perpignan, you and I are working in the ICU. We see the sickest COVID patients. Could you possibly tell our listeners what you have seen or how your hospital has changed to better help COVID patients?
Good evening, everyone. Thanks for having me tonight. So from the beginning of the start of the pandemic, it was tragic. If I can find the words to describe what it was like, it was really like a war zone. And as providers, no matter what discipline, it was kind of like you were fighting to find supplies or find medications or find the things that are needed to be able to provide the care that's needed for your patients. We didn't have a lot of PPE. We didn't have any PPE to provide to hospitals. We were reusing PPE. We were having to share ventilators and having to share CVVH machines for continuous renal replacement therapy. We were very short staffed. Staff members were burnt out. People were just passing left and right, and it was just like we were fighting this battle, like Dr. Walsh said, that we just had no clue what it was and how to really get a hold on it. So it was very scary, especially in the beginning, because we didn't know which direction to look. We didn't have the proper resources and things needed to be able to protect ourselves, protect the patients, and provide adequate care. So it was very scary, very heartbroken. A lot of nurses, from a nurse's perspective, lost their lives from coming back out of retirement to help, and even before retirement, and just putting themselves out there and really stepping up to the front line to really protect our patients as much as we can.
Very well said. Thank you for that rendition. You just made me go through a lot of thoughts of being in the ICU from when this started. It's been a whirlwind. You just made me go through a lot of thoughts. I think we're coming out of it. All right. So, Mr. Todd, you have a very unique perspective on COVID and how it has, affected your area. So I'd like to pose this question to you. The Capital City BNA and the Greater New York City BNA held a 4 hours webinar on men's health during National Nurses Week in June. You all went into local barbershops talking to the men about COVID-19. What did you hear? What did you learn? What did you feel? What was the aura in that barbershop? What did you hear? What did you learn?
Well, first, I'd like to say thank you, and a big remembrance for the people that we did lose during this pandemic, and those folks over there on the East Coast who did put in the work in that very beginning. I know for us over here in Sacramento specifically, we didn't feel the brunt of that first surge until a lot later on. So we were standing with our brothers and sisters over there on the East Coast. But specifically about that barbershop initiative, it was really innovative. It was something that the wheels have been in motion for years. But then we got hit with the pandemic, right? But we all know that healthcare doesn't stop. Health education, health literacy does not stop for anybody, similar to COVID. So we wanted to keep on pushing forward. So, being a part of the National Black Nurses Association, having a phenomenal network, myself, president of Capital City Black Nurses Association, and the Greater New York City Black Nurses Association president, Dr. Julius Johnson, we met in New Orleans, actually. I think it was 2019, and kind of started brewing this idea of doing this barbershop initiative. This is an iteration of my thesis work in grad school, where I did research in local barbershops, trying to understand the job outlook and the emphasis of getting more Black men into professions specifically. So I knew it was a proven modality. People do it a lot. We've seen LeBron James doing his take of the shot in his interviews, and people have done health impact programs via the barbershop for decades. So this was just another attempt with that, but with a nursing lens. And what we found was very similar to like some of the other gentlemen said, but all over the spectrum, right? I think a lot of Black men, rightfully so, have a distrust for the medical profession because they haven't trusted us first and foremost, right? We've heard at this point about Tuskegee, about the malpractices that have and continue to happen to us in the community. So I think that always is where we start, and we hear that jump up first. And then we also hear, well, the efficacy, it hasn't been done yet. You all are here, but we don't see them, quote unquote. We don't see the hospitals here, right? So trying to remember that as registered nurses, as doctors, we are the liaisons between the hospital and the community, and it's a lot of responsibility behind that.
Thank you. Very well said. I have another question that I'd like to pose to you, Mr. Todd. So the barbershop is a very, very sacred place to Black men. I actually went to the barbershop today. That's my check. All right. So my barber and I, we speak about this topic. We've spoken about it probably about 10 times now. He has his perspective on it, and I have mine as well. But I want to hear your perspective on it, and maybe you can kind of chime in on some of the perspectives that some of your other colleagues or other friends have been able to give you. So here's the question. So here's the scenario. You're in the barbershop, you sit in the chair, and you ask everyone in the barbershop, did everyone get their shot? When you hear the responses, give me a message that you send to them. Give me a message that you
well, first of all, you're better than me because as you can see, I'm about 2 days late on my cut over here. But that's a conversation that does happen. And as nurses, and as I think as our physician colleagues would say, I like that happens. That's an opportunity for us to really engage folks and have the discussions in authentic ways better than we can in the hospital. So I'm open to those conversations. So when that scenario happens, I first seek to understand before anything else. Yes, I'm trained as a registered nurse. Yes, I believe in science. But that's just my point of view. That's my lens. And I try to never push my agenda or my beliefs onto anybody else, specifically about the vaccine. So as we do these, we've done several different programs during the COVID-19 around vaccines, vaccine hesitancy. And what we try to do is just provide the most up-to-date information, which is hard to do sometimes, we all know, but we have to provide the most up-to-date information in ways that people can understand and feel comfortable with. And ultimately, especially men, we're going to make our own decisions. I'm not trying to tell nobody what to do or how to do it, but I in my heart, I feel like we all will make good decisions when we have the best information. So that's kind of how I play it, and it's gone well so far. Sometimes it gets heated. Sometimes people, want to stand up and, speak their truth, and that's cool. I know that that's a breakthrough and that's an opportunity to grow.
Josie, what is your input? What has been your experience with that barbershop conversation?
Well, it was a very interesting experience because the neighborhood that I grew up, Crown Heights, Brooklyn, where specifically in the 8-block radius where I live, most of the men now that I used to look up to, or still look up to, more so look up to me. So now conversations with them knowing that I'm a provider and seeing some of the work that I do personally and some of the work that we do as a chapter throughout the city, they tend to lean more towards trust and trusting me and looking to me for information. And it's interesting because I allow, like Mr. Todd said, you allow people to express themselves and not try to push an agenda onto them based off of, my own personal reasoning or experiences, which was always the approach. So allowing them to express themselves, because most of the time they're not going to express themselves, men in general, and if they do, they're not going to really express themselves to people that they don't really trust. So the fact that they were able to open up to me, I was able to understand what they were saying and why they were feeling the way that they were feeling and why they weren't getting vaccinated and why they didn't trust the medical system and why they don't have a PCP and why they don't follow up with their doctor's appointments and keep up with their medical regimen. And with getting that information, I was able to, have them, in a safe space and a trusting space and explain to them like, look, we cannot trust a system for however long we want. It's whatever happened. At this point, it affected us very badly, and it still does. When are we gonna come to a point where we can do research and we can educate ourselves with information and with people that are around us that have the information and start to make these decisions that are gonna better our lives and potentially better the future generations? And I kind of leave it there, and a lot of them reach back out to me and they really, where could I get the vaccination? Which one you think is, and I just provide the information and let them make the decision. But I want them to think about all of the things that they feel and if they're doing anything different than generations previous before them.
Thank you for that response. I think you posed some very good questions in that response, but you're also showing that you're a leader in your community. It's starting to happen quite often, unfortunately, that the younger generation is becoming the leaders for the older generations, and that's okay. But I'm glad that in this situation that you can show them that, hey, this is the way, this is what I've been doing, this is what people around me have been doing, this is what we've seen works, and I actually work right next to the people who are directly affected by this, this pandemic. So I'm very glad that you've had those conversations with them. I want to take a different route, and this is to Dr. Eric Walsh, and I'll also pose the question to Dr. Batiste. So white coat syndrome has been a thing in our community for a long time. I've actually seen my mother have it. I thought it was the funniest thing ever when I first saw it, but after I kind of processed it and researched it, white coat syndrome is real, and it places us behind the 8 ball when it comes to our health. I think it also adds to the health disparities that we experience. So dealing with white coat syndrome in the barbershop, as well as in the treatment room, Dr. Walsh, what has been your experience?
So, I would say the first thing we've learned about blood pressure is that the worst place to take blood pressure in general is in a medical office. So really what I tell my patients is to get a blood pressure cuff take it at home, 2-3 times a day, record the numbers and bring them in. That's far more accurate than what you get in the office for a lot of reasons. Part of it is just the natural anxiety sometimes that comes with coming into the office. And that's not a Black thing. That happens across all colors, races, genders. People just seem to have a bit of an anxiety when they come into the office. But the reason hypertension is relevant is because the way that, as we talk about COVID, is that the way that the coronavirus actually works is that it actually works through the ACE2 receptors, which is very much related to blood pressure control. And so there's a lot of connection between the coronavirus and these things. And so, for example, we now know that coronavirus, there's a correlation with that erectile dysfunction. A study showed coming out in July, that came out last July, which, obviously a lot of men don't want erectile dysfunction. If you get coronavirus, it seems it might make it worse. So, when we start talking about blood pressure, diabetes, and all these cardiovascular risk factors actually already put us at risk. What I look at the coronavirus as is an accelerator, right? So if you get COVID, it can accelerate these diseases to bad outcomes, strokes, heart attacks. So COVID can push you to become sicker than you ever would have been, or faster to an endpoint of hospitalization than you would have without it. So these, barbershops are a great place to have these conversations. And this is great work that's being done because a lot of times the guard is down. Best conversations I've ever had in my life were all in a barbershop. And it's a place where people feel safe to share. There's a lot of talk about the Black community's angst with the medical community. And I think part of that is because we have moved away from community physicians and nurses, Black physicians and nurses in our own neighborhoods. And so often we're going somewhere to get healthcare that doesn't necessarily feel like it's a part of our neighborhood or a part of our system. It's not owned by one of the guys, that goes to our church, a doctor that goes to our church, and not manned by nurses that, go to our church and their kids go to school with our kids. That's changed. And so, there's some fear around it, but I do think I love what both of the gentlemen have said already. I think we're not in a place where we should be trying to force people to do things, but we do need to just lay out some facts and allow people to make choices, because I think that's how we're going to engender trust. And going all the way back around to white coat hypertension, a lot of it has to do with the fact that people go into some of these offices, they don't trust who they're seeing.
Very, very true. Thank you for your input on that. You said a word that a lot of us we hold on to, and we've been holding on to for all of our lives. You said trust. Trust is huge in anybody's community, definitely in our community, and definitely when it comes to healthcare. So some of our listeners would like to know, what is white coat syndrome? Dr. Walsh, if you could answer that.
Oh, white coat syndrome is just, it really speaks to the anxiety that happens when, not really anxiety, but the elevation in blood pressure that we assume is usually due to an anxiety when you see a white coat, a nurse's coat, white coat, a doctor's white coat, and you're in a clinic or in the hospital. And because you feel vulnerable, partly, some folk are worried what their blood pressure is going to show. They're worried that they're going to hear a bad word while they're in there. Their blood pressure goes up. And our blood pressure is designed based on the fight or flight response mediated by a hormone called cortisol to fluctuate. And the reason your blood pressure goes up when you feel like you're in danger is to get more blood to your brain so that you can be more focused and respond better. The problem is this: if you're always in a state of fight or flight, then the cortisol levels stay high, and you go to what we call cortisol resistance, just like there's insulin resistance, it's cortisol resistance. Then your immune system's inflammatory response is not controlled. Don't miss, if you miss everything else I say, don't miss this. When you can no longer control the inflammatory process in your immune system, that's when all of these diseases wreak havoc in your body, especially COVID, because COVID is a hyperinflammation disease that causes a cytokine storm. Here's the message. Black people have got to find a way to bring the stress down. And I have to say, with all the cases going on now, you see all these people, with the one in Georgia, we got all these cases that we follow. Our blood pressure goes up as we see injustice happen around us. Collectively, our blood pressure goes up. We've got to find a way to keep that down. And if we don't, disease will happen simply because we're always stressed out.
Thank you so much for that. Dr. Walsh, you have a solution to that I got a chance to research this week, but we'll discuss that a little bit later on. I definitely want you to speak about that. Mr. Todd, I have a question for you. What do you tell your friends or your brothers, especially young people that you deal with, about the vaccine and how to live their best life, whether they've been vaccinated or not been vaccinated? Like, what's your input to them? I feel like you're very influential in your community. How do they receive your input?
Sorry, there's a little bit of a delay over here, about 15 seconds. But, Dr. Walsh did a phenomenal job of explaining that the white coat syndrome, following up what Josie and myself were talking about and reaching people where they're at. So I try to do with my folks in the community, people in our group, my family, is try to hear people, right? Because a lot of the thoughts and the beliefs come from somewhere. They're not just being plucked out from social media or from anywhere outside. It's from an interaction that they had with a nurse or the way that a doctor made them feel at one time. So I think getting to the core of that, how was your grandmother treated when they were in the hospital with diabetes, and breaking down and getting to the root of the problem to the best that we can. Like Josie was saying, we can't fix the terrible things that healthcare has done to people over the years. But what we can do now, like Dr. Walsh said, now that we have the numbers, now that we have the information at our disposal, what can we do with it moving forward? And that's kind of the emphasis that I give to people is, try to empower folks. This is the information. Look at me. I don't work for them. I'm here because I care about you and I love you. This is the information. And now we try to pull down those barriers and let people move freely.
Thank you. Very well said. Like I said, I'm pretty sure that's well received by the people that you affect. You've been very influential, and we appreciate that. Mr. Perpignan, I have a specific question for you. So young men and women alike in this new generation tend to be very influenced by music, by culture, what we call, by whatever's going on in the now. And it seems as if this rebellious nature has kind of attacked our youth. How do we pierce through that wall that has been put up to make sure that they get vaccinated as well too? It seems as if even if they don't get vaccinated, they tend to live through COVID a lot more than other people. However, they have family members who may not be vaccinated or who may be immunocompromised, and that compromises them. How do we pierce through?
That's a great question. I think social media has a hold on the newer generations now, and I honestly think that a lot of the figures that they look up to have a voice, and they're going to listen to and follow them. And I wish that they had the mentality to not saying that they don't, but I wish that they would utilize that platform more often or more frequently to get to these generations, to let them know like this is serious. I also think that if some households, maybe the parents or the grandparents may have had bad experiences in the past and do not really know how to educate or have these conversations with their children or grandchildren, as they grow, and then they tend to look to the outside to have people to look up to or figures to look up to for information. And it's very sensitive because there are many figures who may not believe in the vaccination, or who may not have experienced a loved one that has had COVID or has passed away from COVID. And it's scary because things that they say, they can really affect the future generations. I think us as healthcare providers, we have to go, as we've been doing, going into our communities, showing face, showing that we care, being a leader, and leading by an example, showing that we're getting our vaccinations, telling them the resources that they have, explaining to them what it looks like for someone to be in the ICU, to have all of the comorbidities that they have, and really paint a picture, utilizing being from the same neighborhoods that they're from, and having them, understand that people are dying every single day. Like, this is not a joke. It's not a game,
Yeah.
and they may not see that, but some may see it. But I think it will hit different if it's coming from us, the people that they see every day in real life. And it's not enough of us to be in the community as much as we want, but for what we have and what we've been doing, we just have to keep pushing and keep, putting ourselves out there so that they can see that it's real.
That's very real. Thank you so much for that. You made a very good point about painting a picture. So for me, pictures are huge. I definitely need to see the grand scheme of things, and it helps me process some of the small, minute things that I don't think are pertinent to the situation, and it helps me bring it all together. Especially being in the ICU. That picture is as big as it's ever going to be, and nobody gets closer to that than us in healthcare. But younger generations definitely, they need to see, hey, this is what's going on. This is what I go to work with every day. I deal with my own stresses. I may have family members that are dealing with this as well too. It would behoove you to not be in a position that some of these people have been, even the ones that have passed away, God rest their soul. I'm glad that you shed some light on that, and hopefully that can be taken to the other people and spread out. Thank you so much for that reply. Dr. Walsh, I have a question for you. This is kind of like the meat and potatoes of what we're trying to get through to our African-American men. So we know that COVID-19 disproportionately impacts men of color who have chronic diseases like cardiovascular disease, high blood pressure, diabetes, especially, those who are immunosuppressed. What do we tell brothers about the vaccine and the impact on their health? How do we get through to them?
I think first of all, there's a little bit of a kind of like a exposure component to this. I think our community now, for sure, this deep into the pandemic, believes that this is real. I remember, many of you may remember that initially there were people saying that Black people couldn't get coronavirus, and that was going around on social media. And then Idris Elba got coronavirus. He contracted it and was like, no, actually, we can get it because I've got it. So I think, we moved past that phase. And in New York, I know one of our brothers here is from New York. New York really got hit bad, and disproportionately Black and Latinos lost their lives. So a lot of Black people, have in big cities especially, have seen the devastation that coronavirus can cause. I think what happens sometimes, though, is that there's this deflection that this isn't really that bad. And even in the private chat, even in the chat, I saw someone say, it's a 99.7% survival rate, which actually isn't accurate. Let's say that the survival rate is 1.5%, right? There are almost 400 million people in North America. If you just looking at the United States, Canada, not even including Mexico. Well, 1% of 400 million people is 4 million people. So even if you said the survival rate was 1%, you'd be looking at 4 million dead people. No government, nobody wants to see that happen. And some of us who go to church, that you might lose 2 or 3 or 4. Some of our churches, a lot more of our elders, and even some of our younger people to this virus. And you begin to understand, okay, this thing is dangerous. It can kill. It doesn't kill everybody, but some people just get these really bad long symptoms after, which we don't quantify that as well as obviously as we can death. So for some people, they have to understand the risk-benefit ratio. If you have high blood pressure, diabetes, are chronically stressed out, have erectile dysfunction, have had a stroke or a heart attack in the past, have kidney disease, any of these things, plus a few others, the vaccine really is something you should get because you want to protect yourself from hospitalization and death. There's a lot of argument about whether or not it keeps you from, about whether or not things are spreading and so forth, but in terms of spreading the virus. But I think you have to remember that no matter what, if you're vaccinated, it helps you to hold down the amount of viral load you have. And that means if you are going to be contagious with it, you're going to be contagious for a shorter period of time and maybe even to a lesser degree. So there's a lot of information people just have to understand. This is not going away. And going into this winter, I think we're going to see a resurgence of the coronavirus. And whoever isn't vaccinated is really going to be at risk for severe disease because the virus is mutated.
Very well said. I have a follow-up question to you, Dr. Walsh. So I have heard some of the men in our community say that they feel like the vaccine changes your DNA. And this is the government trying to control what we do, just a population surge of control. How do you debunk that myth? What can we do? What type of information can you give to these men who may not exactly know how it works, but this is how they feel from the government? What confidence can you instill in them?
Well, I think, one of the things that I don't think has been shared very well is that the Moderna vaccine, one of the principal people who developed it is actually a sister, an African-American woman who actually helped to develop it. And, just knowing about her, she clearly is not a part of some grand, conspiracy to destroy Black men, for sure. The truth of the matter is, we've studied, those of us on here probably have studied biochemistry, cellular molecular biology, all these different things. And so you understand that messenger RNA cannot change DNA, just like although a book comes from a tree because it's made of paper, you can't take a book to a tree and change the tree. So when people think, okay, we're going to change the DNA, it would be like taking the Encyclopedia Britannica out of your house to a tree, and somehow the tree could turn from a pine tree to a palm tree. It just doesn't work like that. It's an impossibility. It just can't happen. That's the first thing. About government control, let me tell you something. If I was going to protest in the streets about government control, I might pick taxes to do it over. Because if every 2 weeks the government tells you just who's in control, when out of your check, without you having any say in not only how much they take to some extent, but also what they do with the money. So think about that for a second. They take your tax dollars and they can buy a bomb, they can build a plane, they can fund Doritos and fast food joint. They can do whatever they want with it. It's the government. So the government already has control. During the Vietnam War, they took young men and sent them to fight to the death. Most of the young men sent over that didn't even know where Vietnam, couldn't even find Vietnam on a map. The government has always had control. The issue here is what we're dealing with real, and is what the government doing out of proportion to what's happening? And I think that's what you have to ask. And once you understand that we have used vaccines, because many of these men in my clinic, I just asked them, have you ever been vaccinated against anything else? They're like, yeah, I have all of my vaccines. And then I just explained to them that, well, if you don't like the mRNA vaccine, the Johnson & Johnson is not an mRNA vaccine. And there are other vaccines that'll come on the market that are also not mRNA vaccines. So the government already has control. It is, but I will agree with them. You can see the government's muscles in what's happening when they start trying to do these mandates. But you also see that we're a part of a democracy, because these courts in Louisiana have now shot down the mandates now once, and then it's been supported by the second court. So it's not it's not the mark of the beast that, the country's not going to be taken over. But I think we have to understand that there are people who are going to die because they didn't get the vaccine. And I think that's really the drive home message. And every man has to ask himself, am I someone who would die because I didn't get the vaccine? Or am I living with or going to come in contact with someone who could die if I gave them the virus? And that's really the questions you have to ask yourself.
Very well said, Dr. Walsh. I want to make a shameless plug. For anybody who's currently viewing this webinar, if you have men that feel that way, if they feel like the government is trying to overtake them, please forward them this webinar. It will be up on the site at some point of time. The mark is about the 37-minute mark, and please just have them review it as many times as they would like. That was very well said. Thank you so much for that analogy. I'll make sure to forward it to the people that I know as well too. Mr. Todd and Mr. Perpignan, I have a question for you both. And because you're in the ICUs just like I am, I feel like you both can answer this question. So we deal with gentlemen in the ICU a little bit differently. They tend to have an invincible, not necessarily makeup, but they feel like I shouldn't be here. This is just a disease that's trying to take me down right now. I'm going to beat it, blah, blah, blah. And they may go on to live, you know, with the residual effects of COVID. It may stop at the ICU, hopefully not. How do you deal with these invincible Black men who feel like they don't need any input from the government? They don't need a vaccine. They don't need medicine. That them being here is just a coincidence. How do you deal with these gentlemen?
You want me to go first, Todd? Okay, I'll go first. So typically, my approach in an ICU at the bedside typically is I want to set the tone of what the relationship is going to be like between myself and the patient and the patient's family members. I like to treat the space as if it's their own space, and I like to make sure I maintain that level of respect. I like to open it up so that they're comfortable enough to speak. What I noticed about most of the men, Black and Spanish men, who come in, they have a tough, like you said, invincible, untouchable, prideful attitude, and I like to kind of like pick at it like I'm picking at a ice cube or something, like with a fork or something, and just picking at it, respectfully and at a slow pace, to get them to open up and explain to me why it is that they feel the way that they feel. Why don't you want to call me when you're in pain? Why aren't you having why aren't you following your regimen, your medicine, or your diet regimens or anything like that? And once I get the opportunity for them to see that I'm trusting and I'm from where they're from, I just go straight at it. I use examples. I speak about family. You're supposed to be the man of the house. What example are you setting? I know you're scared. I know you don't trust. I know you're hurt, but you not speaking out and you not showing that vulnerability, you're only carrying on the same characteristics and attitudes that the men previous to us were doing. You know what I'm saying? And sometimes I find myself having to show my vulnerability, speaking about times that I've been scared, or times that I've failed, or times that I just didn't understand, or times that I didn't trust, and letting them know that it's okay. We're human. We have to express ourselves. The sooner that we are comfortable with expressing ourselves and not feeling like we're going to be judged, the easier it is for us to make decisions in life and really go down the path that's going to help us live healthier and better lives, and also be strong men for our families and the younger generations that are looking up to us. So having them be open and really explain and think about what it is that they're doing and why they're doing it, and know that I'm creating a environment for them to be open and to be able to express themselves.
Thank you. Very well said. Trust amongst men is huge in the ICU, and it's huge amongst our generation and just men in general. But thank you for giving us that insight. Mr. Todd, that same question is posed to you. What is your input regarding how to deal with men in the ICU who may be a little bit stern, a little bit untrusting of government, a little bit unbelieving of what's currently going on in our society?
Building that trust and being as healthcare providers in an ICU situation, we get the opportunity to connect with our patients and our families in ways that you can't do anywhere else, right? When someone's back against the wall, when you are literally keeping them alive with your drips and your tubes, people tend to listen a little bit more differently. And it hurts when it takes that to have someone finally understand. But I've seen this big circle happen, right? The invincible person, and then they go through the whole process, and breaking down to crying, right, and telling me, it shouldn't be like this, or I should have got the vaccine, right? When people tell me that, it really hits me a certain kind of way, because it's like, at this point in the game, we've been doing this. We've had the vaccine out for, I got mine in December of last year, so over a year. These webinars like we're doing, they are accessible. They are here for people to learn from. So just, heed our warning that it shouldn't come to that. We are here trying to help you all. And what I kind of say, to people in the community and in the hospital is, if they were trying to do something silly or had an ulterior motive, why would they give the vaccine to the nurses first? That's a terrible model of making this all work, right? Because if you knocked out the nursing population first, it would all go down, right? So from the jump, I said that. I was like, they gave us it first before anybody else, and we're doing fine. We're doing just fine. I was the first in line to get the booster. I got a little bit of a reaction, a little bit of a fever. That's what's supposed to happen. And like Dr. Walsh said, we've gotten vaccines our whole lives. If you're in public school in the United States, there's a good chance that you have vaccines already in your system, and they've kept you safe, they've kept you healthy, and our communities are healthier because of it. This is just a new iteration and a new advancement in technology. Go to other countries, right? They would do anything to get these vaccines. I talked to some of my coworkers who are from other countries, and their families are lining up, walking days to get these vaccines, so trying to just elicit some of that perspective for folks. And what I tell my buddies is, you don't want to come see me at work. Trust me, you do not want to come see me.
Very well said. Thank you, Mr. Todd. You are correct. You do not want to come see me at work. That is not a place where I will bring my kids or anybody else in my family. If you end up seeing me, there's a problem. And I'm sure with you as well, guys. Dr. Walsh, this is a question for you that I'd like for you to answer. So what do we tell African-American men who have received one shot and have not gotten the second shot? Reason being, let's say they took the first shot, but they may have become ill. They spiked a fever. They had cold symptoms. Everything that we hoped would not happen to someone who was afraid of getting the first shot. What do we tell them about getting the next shot? What do we also tell them about mixing and matching vaccines?
Well,
we have that conversation?
Let me start by just addressing, why there's the angst exists in the first place, and why if they have a slight fever or body aches, which somebody just mentioned, it's supposed to happen. You're supposed to have an immune response. Those are immune responses. Symptoms are not disease. They're symptoms. They happen because your body's fighting something. In this case, we're staging a fight so that the body learns the enemy without having to actually deal with the enemy. And so even in the private chat, you're going to see a lot of people talking about blood clots and side effects of the vaccine. We know that over 700,000 people have died of COVID. Almost more than half of the whole planet. Billions of people have now been vaccinated against COVID. And in the United States, at least, people talk about a few thousand people have had these bad reactions, to the vaccine, none of which are proven because they're basing it on self-reported things. We have picked up some things like Johnson & Johnson has a very low incidence, very low, like 1 in a million of blood clots. We also know that the Moderna or Pfizer vaccine can have very low incidence of myocarditis and other things like this. And I think what people have to understand is if you get the vaccine and have a bad effect, it's because the virus would do the same thing or worse. So people who get coronavirus have increased risk of blood clots if they get infected with the virus itself. They have increased risk of all kinds of inflammatory conditions, including myocarditis. So a lot of times the vaccine, even if you had the side effect, is less than what the virus would have done to you if you got the full-blown infection, which is what we're trying to avoid. So if you get the vaccine and you get the first dose and you get the shakes, the chills, a little fever, whatever, and usually it lasts less than 12 hours, and you're going to be better because your body just is learning the antigen and able to mount a response, right? So that's, again, that's what's kind of supposed to happen. It usually also means that you may have already been exposed to the coronavirus. So you have a bit of an ability to respond. And so when you got the vaccine, your body had more of a response. So some people who get the vaccine, sometimes they get more of a response with the second one because the first time they were ever exposed to it was the first shot. I would tell people that what we now know, people are talking about what are the long-term effects of these vaccines? What are the long-term effects of these vaccines? We now know that there are terrible long-term effects to the actual virus and being infected. I have a friend, I used to work out with his son, 20-something years old. and he got COVID, and 10 months later, he still was not back to his workout regimen or strength he had before that. That's pretty scary. This is a 20-something-year-old. So I know older people who've gotten it, and 10 months later, they're on oxygen still and were not before they got COVID. So there are long-term effects to the infection for sure. But ironically, we know 6 to 8 months, now we say somewhere around 8 months, the effectiveness of the vaccines seem to begin to wane, which is why they're now pushing boosters. Just like annually you get a flu vaccine, just like when you give hepatitis B vaccine to a child, they get 2 and then they get a third one, a booster later on. Just like if you stick yourself with a rusty needle and go into the urgent care or into the emergency room, after getting stuck with a rusty nail, they're going to want to give you a tetanus booster if you haven't had one in 5 years. So we give boosters already. This is something that we do with immunizations. And this one might be more important. And I would stress to everyone to really be careful. This winter is going to be a dangerous winter. If immunity wanes, and even people who've had COVID before, it seems their immunity wanes as well. If immunity wanes and you're watching the Patriots here in New England, the Giants and the Nets and the Knicks in New York, the Kings in Sacramento, or the Lakers in Los Angeles, and 30,000 to 80, 100,000 people are in the stadium, no masks, and immunity is waning. Imagine this winter when everyone goes inside because most of our country is cold and the days are shorter. Imagine how this virus can spread again, and people can be caught off guard and get very sick. We still don't have a cold cure, like a sure cure for this. So this winter could be very dangerous, and that's why the boosters are kind of important, because we need people to have the immunity going into this winter. Again, I'm not trying to force anybody to do anything, but I think you can watch the numbers. That Delta graph was dropping, and bam, football season, basketball season started. I think it's plateaued and it's probably about to start heading back up, and hospitalizations are going to go up, and that means deaths can go up as well.
Very, very true. Thank you for addressing the boosters. I took a look at the comments, and it is lighting up in here. So that is one thing that everybody wanted to stress, making sure that the boosters were of primary importance to everybody in our community. One question that really stood out to me that I would like any of you to take, so you just chime in at whatever point you'd like. What do you say about the doctors and nurses that won't take the vaccine? Anybody can take this question.
Let me jump in. I'll speak for the doctors. Over 92% of doctors in the United States are vaccinated. And I think you have to, if you understand the physician community, they're relatively free-thinking people. So they wouldn't just do it because everybody else is doing it. At first, let me just be honest. This time last year, I was like, I'm not so sure about getting a vaccine. Last year in November, I was like, I was wondering about the process and so forth. But what I did was I said, you know what? I stand in the gap, just like these two great nurses, all three of you great nurses that are on the program with me tonight. And we face people with COVID. I mean, this is not some mythical disease. I mean, we actually see it. And I have to ask myself, do I want to get this because I'm going to be in the middle of this every day, all day, 12-hour shifts, dealing with people with this virus? And then I went and did the research myself. I read the studies from Pfizer, Moderna. I looked at what it meant. I went back to the basic science around mRNAs and lipid capsules and looked at it again. And I said, you know what? This actually makes sense. This is a technological advance. The first papers on mRNA technology was written in 1990. We've been using this technology since 2001 or 2002. So it's not brand new as people try and make it out to be. And I just looked at it and I said, you know what? The risk of this disease is far more worrisome to me than anything else. And if it can reduce the chance that I bring it home to my elderly loved ones, my wife, kids, then I'm going to go get vaccinated. And once I did the research, I was comfortable with it and I was vaccinated. I'm not vaccinated because anybody told me to be or because anything. I am very disheartened by the amount of misinformation, that's the way I'll say it, that is out there about this. It is really sad. Because if the death rate wasn't 1% and it was 10%, I mean, we'd have people dropping like flies all around us because they're believing the lies that some of these people are telling.
Very well said. Thank you. Go ahead, Josie.
I was gonna say we have to think about the message that we're sending. You know, you ever go to a car shop or a car dealership, and you ask the person that's trying to sell you a car, "Oh, you have this car too?" And they're like, "No." It makes you wonder, like, well, what car do you have then? Well, you trying to sell this to me? So to me, I think I respect that. You know, we have the opportunity to have our own values and views and beliefs, and the opportunity to make decisions based off of how we feel. But realistically, I think we may be doing a disjustice to our communities and the patients that we serve, because they are going to look at us to see if we're being vaccinated as well. And the moment that they see that we're not, they're going to lose a little bit more trust, and it just sends a very bad message. And I think it's scary, and to me it's kind of, sad. Nothing against those that make the decisions not to. It's your own personal choice. I respect it. But I think as providers, um, patients look to us when they need us most, and for us to show that, we're in this with you as well. We're not just the people that are going to be out there just injecting you and giving you medications and doing everything that you experience in the hospital, but we're here to go through everything that you're going through with you, because it can be us that are going through it, if not us, our families as well. And just being a leader and leading by example and showing, like, look, we're scared too, but this is the best thing for us. And to show you that, we're going to step to the line and step up first to show you that we're doing this not only to protect ourselves, but to protect you and anyone else around us.
Very well said. We are the front line.
I'm going to go for myself. I have to go ahead and be a little bit transparent. I have a big issue with it, for the sense that we're scientists at our core, right? All of us. We understand science. We practice science. We studied it. And all of us, Dr. Walsh, Josie, Javaris, we've all gotten vaccines and have proven that we've been vaccinated before we could touch people, before we could practice our profession. That isn't a new idea. So why is it now that you think that you know better than what you've been doing? And then, like Josie was saying, where's the information coming from? Where did this change come from? Why are people all of a sudden digging their feet in with this? We have to remember where our country was when COVID hit. The political, the social context of when everything happened. I believe a lot of a demographic still has their heels in on one side, and I believe that another part of the people still just want to be right about something. And it's not about being right or wrong. It's about using the evidence, right? As scientists, believe us in saying that we don't have a skin in the game. None of us are getting paid by Pfizer or Moderna to be on this talk. We're here to give you the best evidence and the best practice that we would recommend, that we do for ourselves, that we would tell our family members and loved ones. And that's it. And that's all I'm going to say. I'm lucky that I got a 15-second lag.
All right. Thank you, Carter. We appreciate that input. Everybody, this has been a very, very, very well conducted webinar. I'm very glad that we had it on this Wednesday night. I hope everybody gained a lot from it tonight. Solutions. We can sit here and talk about a bunch of things tonight. Misinformation, if we can get away from that, I feel like we'll have an upward projection of the health of our community. So despite your opinions on how you feel about the virus or how you feel about the vaccination, make sure that misinformation is not in your decision process. Make sure you have solutions, you have the facts before you make any decisions. I'm not here to steer you left or right, but I feel like the science kind of speaks for itself, and whatever you depict from that, we'll leave that up to you and your family. Before we end, we'd like to thank all of our panelists here. Thank you so much for taking the time out to give this information to everybody in the comment section. Everybody loves what you guys have said. And I'm sure that all of this information has been taken in Very well. We'd also like to give a big thanks to the National Black Nurses Association. Ladies and gentlemen, thank you for being a wonderful audience for this webinar on African American men and COVID-19. Thank you to our host, the National Black Nurses Association, blackdoctor.org. Thank you so much. And also thank you to our sponsor, Johnson & Johnson. This has been a great night. We've made some friendships here in the chat box. We've made some friendships amongst panelists, and we just appreciate everybody for coming out and giving that support. Make sure you link them to blackdoctor.org. When this gets recorded and edited, make sure you send all of your family members here so they can hear the conversation that we had tonight. I won't keep you much longer. Thank you so much for your time and have a great night.